Hello and welcome to South First, where we narrate the other half of India's story. I am Chetana Belegere, and we are here in conversation with India's top virologist from CMC Vellore, Dr. Gagandeep Kang. Dr. Kang, variant BF.7, the variant which is said to have been causing the surge of COVID-19 cases in China, was found in India in July. Now, the surge in cases in China and other countries has created a panic kind of situation in India. Several measures are being taken by the government of India. But tell us if finding of these variants in India is something to panic about.
Okay, let's take the key points first. One, there isn't a lot of COVID in India today. It hadn't gone away, so it isn't back because it's always been there at a relatively low level over the past several months. In terms of the variant that China is seeing, as you said, we've had this variant for a while. And this variant has not gone out of control in India so far. So nothing has changed from last week to this week, except that China has made a decision to open up. Now, for China, the situation was not good before they started to open up, and it's going to get much worse for them in the coming weeks. That doesn't automatically mean that things are going to get bad for us in the coming weeks. The variants that are present in China are variants that we are familiar with, we have seen. They have not, as I said, gone out of control in the country. There is no reason to think that these variants might suddenly go out of control. The only thing that can change the situation in India is if we get a new variant, one that we have not seen before, that is capable of immune escape, but not only of immune escape, but also causing severe disease. At the moment, none of the Omicron variants have been worse than the Delta variant that we saw. They are all very good at immune escape, but they are not causing the level of severity of disease that we have seen with the Delta last year. That's
Okay.
the current situation.
Okay. So now that we're talking about if there is a new variant, so how would we know, what are few of the criteria to know whether the COVID variant circulating in India is alarming? What are some of the criteria we need to look at?
Look at the disease. Are our hospitals full? Are we seeing a lot of severe infections in the country because of one specific variant? We are not at this time. One good way to track whether a variant is becoming important or not is to see whether from week to week, the percentage that it contributes to the total is increasing or not, and our total numbers of cases increasing or not. We don't have a variation in the proportion. We don't have an increase in the number of cases. So at the moment, there is no signal that we have anything to worry about with the currently circulating variant. The worries are that in China, there will be a lot of circulation that is going to happen in the coming few months. They will have a lot of infections, they will have a lot of disease, they will have a lot of deaths. Whenever a virus multiplies a lot in a population, there are chances that a new variant will emerge. It's not a guarantee, it's a chance. And if that new variant emerges and is transmissible and capable of severe disease, then we will have something to worry about. And the usual way to track that is to watch for at least a couple of weeks to see that that variant is increasing in proportion and causing severe disease.
Okay.
So we have mechanisms for tracking.
Yes, yes. From random sampling at international airports to bringing back air suvidha forms are some measures Indian government is thinking of. So is this the right move?
Well, I'm not sure what you can do with an air suvidha form because essentially it asks whether you've been ill or whether you've had a vaccination history. Anybody who's made a decision to travel when they are ill is not going to fill an air suvidha form accurately. So, and vaccination, as we know with Omicron, doesn't mean very much in terms of a variant that can infect people quite frequently asymptomatically. So transmission will not be stopped by looking at whether people have been vaccinated or not. But sequencing of strains that come in from random travelers or travelers who come from China is something that is a worthwhile public health precaution. In general, we should have a baseline of sequencing across the country. And then when we start to see an increase in cases, if we start to see an increase in cases, or if we see clusters of cases, or if we know that we have a lot of people from China coming in with a new variant, then those are the situations where we should be ramping up sequencing even more.
Okay. People are not really coming forward for testing. I mean, in general in general population. So how important does testing become now?
Well, testing is important for severe disease and for clusters of cases. We don't have these at the moment. Every hospital should be testing its patients who come in with severe disease for COVID as well as for other causes of severe respiratory illness. And if we see clusters of respiratory disease, we should try and figure out whether this is or is not COVID at all. But if you just have cold-like symptoms and you get better with that, it doesn't really make sense anymore to be testing specifically for COVID.
So, considering the recent meetings, several meetings which union government and state governments, and the entire situation is like way back how it was 3 years before. I mean, almost similar to that. So, considering this whole panic situation which is kind of created, what do you think the Indian government has not done yet in the last 3 years of the pandemic?
I think communicate the science is, I think, critically important to me. And the science has evolved in 3 years. The population exposure and therefore the population susceptibility has also evolved over the past 3 years. So the government is absolutely right to be watchful. The government is right to say that sequencing should be ramped up, though I would say sequencing needed to be ramped up and maintained at a reasonable level even before this. But in terms of some of the advice that was given by the government previously, some of that isn't quite applicable at the same level anymore. So you may remember that the government had asked us to wear masks if we were alone inside cars. That did not make sense then. It does not make sense now. Wearing masks out of doors is very rarely useful because you have pretty good circulation of air outside. So certainly being masked if you are vulnerable, being masked in situations where you're traveling or in crowded spaces, I think that is down to a level of individual risk perception. But I think in general, there is absolutely no need to panic. As I said, nothing has changed from last week or week before. Cases in India are not going up. It is important for us to continue to be watchful. We are going into winter. The rest of the world is seeing a lot of viral infections. Viral infections in general are commoner in winters. So it's a situation where we should be continuing to monitor how many respiratory infections we have and what is causing them. But at the moment, I see no indications that in India we will be in trouble in anything like, let's say, the next week or the next couple of weeks.
So, what about the boosters? I mean, everybody is talking about taking the booster. So, is that important now? Many people have not taken it.
the latest data so there is a question, right? If you take any of the vaccines that are available in India, these vaccines are all based on the Wuhan strain. The Wuhan strain isn't circulating anymore. It is the Omicron strain or its subvariants that are circulating now. About 90% of the country has received 2 doses of vaccine. About 90% of the country has been infected, and most of those infections were due to Omicron. So we have pretty good hybrid immunity. Now, there are recent data that have come out from other parts of the world that seem to indicate that in older populations, if you take a bivalent booster, that gives you an increased level of protection. Now, if I was to think about advising people who should be taking boosters, really it needs to be older individuals. And in India, we say older is over 60. In the rest of the world, the kinds of studies that are being reported, they're usually reporting the effectiveness of vaccines in people who are over 75 or people who are over 85. And that really is, for us, a small part of our population. Bottom line, I think if you're an older person, taking a booster is a good idea. I am uncertain of how much benefit it would have for younger people, given the fact that we have had high levels of vaccination and infection.
Okay. So, coming to your last question, what should people of India be doing now? I mean, we're talking about the government and the surveillance, etc. But is there anything which people should be in particularly doing something to prevent?
I think for people to prevent COVID, well, if you don't have COVID in your community, how are you preventing it, right? Right now, we have 3,500 cases distributed pretty much across our entire country. So what is the appropriate level of precaution? So to me, right now, the appropriate level of precaution is if I'm in my general environment, then I don't need to do anything differently. If I go into a new environment where I am uncertain about the risk or where I have heard that there is higher risk, then I would worry and I would say, okay, here is where I need to take preventive steps. Otherwise, I don't think that we need to change anything that we are doing. Watching what's happening in the rest of the world is important because it is a signal that there is trouble out there. But at the moment in India, and therefore for the next couple of weeks at least, I don't think we have anything much to worry about.
Dr. Kang, I just have one more question. I'm sorry, I can't stop myself from asking this question. What shouldn't the Indian government be doing now? What shouldn't it be doing?
I think the government, when you have these very, very high profile meetings, it gets people worried that there is something that we don't know or we don't understand. And I don't think that that is the case. What the government is doing is getting ready to sequence, making sure that our preparedness systems are in place. All of this is good things, but hyping it up and declaring mandates when nothing has changed really from the last couple of weeks, I'm not sure how useful it is.
Thank you very much, Dr. Kang, for your time. This was a very eye-opening discussion and also very reassuring to know that there is no need to panic. That is all we have for today. Thank you very much.